you this afternoon to the Ideas Forum for February 27, 2025. We are so pleased this afternoon to have with us, we're having a little technical difficulty with one of our speakers, but we're going to move to our speaker, Dr. Kimberly Delgado. Dr. Delgado is a PhD graduate from East Carolina University College of Nursing, and she is on the faculty of the College of Nursing and has been part of the Carolina Geriatric Workforce Enhancement Program grant since 2022 and is a long-term care expert and all things older adults and caregivers expert. And we're so pleased that she is here today to present with us on Who's Caring for the Caregiver, Part 2, which is really Part 1 today. Where do we go from here? Dr. Delgado.
Oh, thank you so much. Yes, so I'm going to jump right into Part 2. And when we get Amanda situated, she's actually going to give you some additional information about current resources out in the community. I am going to let you know just a little bit about the Carolina GWEP grant. So for those caregivers who may be on and are not familiar with what we do, I'll briefly talk to you about the services that we currently provide and then some things that are to come. So our team, which consists of Dr. Robertson and Dr. Matthews and myself, and they're both on. Thank you for being here. And so we are HRSA funded. We serve all of Eastern North Carolina. So everything east of I-95, from the Virginia line to the South Carolina line, we are here to serve the community. It doesn't matter if it's a senior center, if it's a church, if we're asked to come, we come. And we actually work quite frequently with our other presenter today, Amanda. So we've adopted her somewhere along the way, and she's family. So what I'm going to talk to you about today is just what we currently do on the grant, which focuses on what matters to the older adults and long-term care organizations, and then talk to you about some things that are in the works and to come. So I just want to start with Amanda will give you some additional information about the current condition of, the environment, Eastern North Carolina in general. But I want to tell you and just emphasize the importance of increasing the available resources to our older adults. So Silver Tsunami, I think everyone else, celebrated New Year's Day. And I was like, oh, 2024, Silver Tsunami, record numbers of people turning 65 in the United States. And that's my population. So, but that number, the number that we have and have had, will increase significantly. And by 2060, we will have 88 million older adults in that we need to provide care for. And if we're struggling to provide care now, we are in for it if we don't do something. So, again, our grant focuses on what matters. And as important as it is, to focus on what matters to the caregiver from the professional perspective, focusing on the families and the individual that we're caring for is extremely important. And that's the piece that often gets missed. So currently on our GWEP team, we provide individual events and team events, and these are just some of the topics. So we talked about anything related to dementia care, general brain health, our Brainiac Boot Camp every summer at Pitt County Council on Aging. We have record numbers come out. And we really just want to emphasize not only the importance of care after the diagnosis, but also prevention of the diagnosis. So where are we going from here, though? The caregiver challenges that we're experiencing did not develop overnight. And so it's going to take an interprofessional, multifaceted approach to fix, right? So as frontline caregivers, nurses are in the ideal position to lead that change, whether it be the nursing workforce or the nurses leading the way and providing resources to the community and to the family caregivers. With that being said, an initiative that is in the works right now is our Caring for the Older Adult Immersion course. And Carolina GWET team will be rolling that out this summer at East Carolina University. If you are a family caregiver, don't go far. I'm coming back for you as well. So with the nursing student and nursing workforce issues that we've experienced, nursing homes, we are not equipped to provide the care that is needed for the numbers of individuals that we currently have. So without intervention, it will be absolutely impossible to provide care for that 88 million that is to come. And we know that, there's a huge discrepancy between the reported numbers of nursing staff and those that are actually at the bedside, because currently there's no regulation that, nursing homes can't include administrative nurses in their counts. And so what that does is it leaves, there's misinformation, and we're actually at a greater shortage than what we think we are. And so we have 425 nursing homes in North Carolina, and they all need nurses. They all need registered nurses. Okay. And the problem is, and I'm frequently asked, well, why do we not have as many registered nurses in the nursing homes? And from a nursing perspective, if I was trained to care for 4, 5, 6 people at the most throughout my clinical experiences in school, and I walk into a nursing home and now have 30, 40, 50, or 60 residents or more that I'm responsible for and staff, I don't know what to do. I don't know how to get there. I don't feel safe, scope of practice. I don't want to lose my license. And so even when you look in the textbooks, nursing homes are underrepresented in the textbooks. I actually saw one recently and they mentioned CMS and nursing home, and I was shocked, and that was one textbook. So we're vastly underrepresented, that long-term care workforce. So what we want to do is make sure that we are exposing students during their training to long-term care experiences. And currently, first semester students, it is not a requirement for schools to send their students to the nursing home. And we have a lack of available nursing homes for clinical sites because of sanctions from whatever else is going on in the nursing home.
They can see where you are.
So we have a lot of issues that may prevent us from having access to the nursing homes, but we also just have also a lack of faculty who are comfortable and equipped to lead the way in the nursing home. Right. So our course, we want to not only expose the students, but expose acute care faculty to the long-term care setting also, so that we can increase the number of long-term care clinical faculty. Right. And for the course, we actually have space for 5 students for the summer session, and 2 faculty scholars who will get comfortable with clinical and how do I lead that clinical in the nursing home over the summer. So what we're going to do in the course is some of what we currently do with the Carolina GWEP team. So we're going to do that dementia care, dementia training, but we're going to add in health promotion and role of the BSN RN in the long-term care facility. And what do you do? How do you manage, 30 residents or more, oversight of staff, coordination of care? What do I do if my LPN or my med aid calls out and it's just me on the floor having to give medications and treatments? And so just, what do we do besides just say, I'm not doing this anymore? And in addition to that, we have some experiential components. So they will actually have hands-on experience with the virtual dementia tour and other aspects of dementia care. But they will also go to the last 4 days. Toward the end of the course, there will be 4 clinical days where they will be in the nursing home and learning and then putting their hands and their feet, to the fire and saying, this is what we do in the nursing home setting. So I'm just going to hop back to my caregivers, my family caregivers. We did not forget about you. Okay. This is last for me, but surely not least. This is a Activities of Daily Living Caregiver Simulated Training is a proposed pilot study that I hope to be rolling out this summer. Going forward, if you see ADLs, that's Activities of Daily Living. For this, the research question was, can simulation-based training improve the lay caregiver and client experience when provided in conjunction with content-based training? For this, the research team, I would be the PI on the grant, but Dr. Robertson is more than willing to be my research mentor. I have a statistician, and I will be adding a nursing student in addition. So the purpose of this study, we know there's a need. There's a need for resources. There's a need for training. And only half of all people, all families that have a loved one who is diagnosed with dementia, any form of dementia, only half receive any type of information when they leave that doctor's office and they receive that diagnosis. So if they only receive paper, how much are they able to do going forward? So during my time in the community, even on campus, as I've talked to people about caring for their loved ones, especially students who've taken on the role without even knowing it was to come, taking on the role of caregiver because mom or dad is the caregiver and now they're caring for grandma or grandpa. They're just given the role, but they're not given the training. And so many of them have said, well, you do this training with people in the staff in nursing homes. You do this training with, the students, but why can't we do something like this with the family? It would have been nice if my family had, training on how to take care of, my grandmother or my grandfather. And so that is something that I really want to help with and make sure that not only is the professional caregiver equipped, but the lay caregiver is equipped as well. And so refusal of care generally is a challenge that a lot of families experience. And as I've always told my nursing staff, refusal of care has a lot to do with the approach. And if you're not trained to approach an individual appropriately, you may get a response that you don't want. And so this training is designed to help with that. So the timeline for the training is to roll out the pilot study this summer, starting with a more in-depth literature review. So seeing what families have reported are the biggest issues as far as activities of daily living go, and tailoring the training to what those concerns are. So which aspects of, is it bathing? Is it, oral care? Is it something else? We know what activities of daily living are, but we can't cover everything in the time frame of the training. So we want to narrow it down. The training will be 6 hours in length per session. Each participant will only attend one session, but within that training, they'll also have hands-on experience. And then, so literature review will come, then we'll tailor the survey tool and questions that we'll use post training. And then for phase one, what we'll do for phase one is we will have participants come in for the training, and then we will follow up with them 2 weeks, 6 weeks, and 2 weeks, 6 weeks, 2 weeks, 4 weeks, and 6 weeks post training to make sure that, anything that they see as needing, they need a repeat training, or they feel like they didn't get enough, or it worked the first 2 weeks and it didn't work later. So that way we can tailor training, because we will do a phase 2 of this. And so recruitment, the way recruitment will look is I have some community partners like my lovely, lovely Amanda Biggs with Project C.A.R.E, Pitt County Council on Aging, Mideast Commission. So those people that we work quite frequently with have already agreed that whatever we need in order to implement this with, the caregivers that they serve, they will assist with. And then social media recruitment is another great way, and you can't get better than word of mouth. So those are some of the things we plan to do. And So this training, not only will we cover the positive approach to care, virtual dementia tour, things that we currently provide, but it will add in hands-on training in a simulation lab that nursing students currently use to make sure that it's not just me telling you, but it's me showing you. And then you get to demonstrate and you get to practice safely. You know, it's not me coming into your home and saying, let me show you how to do this. Now practice it on mom or dad. But you're practicing on mannequins in a safe environment where if you're going to make mistakes, that is the place to make mistakes. And so the trainings will be based on trainings that exist now for professional caregivers. So nursing, their NCDHHS has several trainings for nursing assistants and home care training modules. Those will be tailored to the needs of the participants based on the literature review initially, and then phase 2 will be based on feedback from phase 1. Where they can, you know, how comfortable do I feel performing this skill, or how easy is it for me to perform this skill? And then that will be followed with some qualitative questions as well. All participants for the study will receive $75 per session that they attend. There again, it's one session, but they will receive $75, and that is to help offset the cost of them having both of these upcoming interventions is to increase the number and really to sustain the caregiver workforce, whether it be lay caregiver or professional, because as I stated earlier, the numbers are going to increase. And as people live longer and the number of people are increasing, we will see an increase in the number of people living with dementia of some form. So not only meeting the needs by number also, but also they're able to competently and confidently provide that care, because there are so many things that can happen when you're not equipped to provide the care. You know, we have, you know,
Dr. Delgado, we have lost you. Today is a day for technology woes, apparently. If you have questions for Dr. Delgado, just jot them down and hold on to them. And at the end, we'll give you an opportunity to speak with her. Thank you very much for that presentation. So now, look at that smile. We have Amanda Biggs, who is a certified dementia practitioner. She is a trainer for Teepa Snow's positive approach to care and a facilitator for the virtual dementia tour. And as Dr. Delgado said, somehow or another, we lucked out and got her. She volunteers quite frequently with our GWEP activities, and it's because she is the Project Care Family Consultant, which is caregiver alternatives to running on empty with the Mideast Commission, Area Agency on Aging, and she is going to talk to us a little bit more about what she does and what resources are available. So welcome, Amanda.
Thank you. Can you hear me? Awesome. Yay. Thank you. And I do apologize for the technical difficulties, but thank you guys so much for having me. So who's caring for the caregiver, the overview and some resources. What is Alzheimer's disease and other related dementias? It is a debilitating condition that impairs memory, thought process, and functioning primarily among older adults. The effects of these diseases can be devastating, both for the individual affected by the disease and their family members as well. So we know this to affect the family holistically. People with dementia and related dementias may require a significant amount of health care and intensive long care services and supports, including but not limited to, just managing of chronic conditions. They may have other things going on outside of just the dementia diagnosis. They may need medication administration, 24 hours of supervision, and I mean 24 hours, 7 days a week. It is a full-time job for a lot of our caregivers. They may need assistance with their ADLs, caring for activities of daily living, such as eating, bathing, toileting, and dressing. In the United States, Alzheimer's disease or related dementias affect as many as 5 million people and nearly 40% of the population aged 85 or older. Roughly 13.2 million older Americans are projected to have this by 2050. I mean, we are here. We're halfway there in 2025 as of right now. In North Carolina, the light bulb moment for us now is 2025. And estimated by the Alzheimer's Association, they project that 210,000 North Carolinians alone will have Alzheimer's disease or related dementias. Next slide. In North Carolina, there are approximately 369,000 caregivers providing 8.1 billion with a B of unpaid care. The main reason caregivers provide care is to desire to keep their family members and or friend at home. Not everyone is a blood-related member of the family caring for someone living with dementia. So we got to keep that in mind too. Sometimes it's a neighbor. I had a caregiver who inherited her grandmother's friend who the grandmother was caring for that had dementia, but the grandmother passed away. So the granddaughter inherited the care of this loved one. So, it can not only just be a blood-related family member, it can be a friend as well. Let's see, the main reason caregivers provide care is the desire to keep a family member and or friend at home. On an average, this can be 30 hours a week, on an average, and which is another full-time job. Some of our caregivers have to retire early. Some have to move back home in with their loved one or move their loved one into their home with them. And you talk about the different family dynamics. If you're a caregiver who has a family of your own, you work 40 hours a day on your job, 40 hours a week, my apologies, on your job. And then every day you're coming home to be a caregiver for someone living with dementia. That can be a challenge all in itself. So living at home with dementia, a person with dementia can live at home for years. I mean, with the modern technology that we have now, they are living longer. Eventually they can die at home, depending on the type and severity of the dementia, the level of support that they get, and the individual's needs. With the right support, people with dementia can live longer and with a higher quality of life. Assisted technology can help people with dementia live independently and safely at home, but do understand that not everyone, is appropriate for staying at home. Safety is key. And when we say safety, we're talking about safety not only for the person living with the diagnosis at home, but we're talking about the person that's caring for them as well. Okay, safety for everyone. Next slide, please. Again, I just want to reiterate, caregivers are providing $8.1 billion of unpaid care, billions with a B, and that is astronomical. That is just too much. On an average, that's about, again, the 30 hours per week, another full-time job. And this alone increases behaviors for that caregiver of burnout, feeling overwhelmed. They're so stressed, they're depressed, their anxiety. they're aggressive. I mean, all of the feelings that someone living with dementia can feel, they can feel as well. So caregiver burnout is very, very real. And that's why the program that I work at Mideast with and support for the state of North Carolina, Project C.A.R.E, we provide those little snippets of relief. We help caregivers to get a little bit of a break so that they won't be so overwhelmed, so that they can be able to get, do some things on their own that they aren't able to do for themselves because caregiving has consumed them pretty much most of their life. Okay, next slide, please. What does the burden of a dementia caregiver look like? Caregiving can be challenging in many ways, including emotional, physical, and financial. Experiences such as, coping with grief. You're dealing with the decline of a loved one that's right in front of you. Their health can be emotionally draining. They know one day they may not. I mean, one of the biggest hallmarks of the diagnosis is the memory. They may not remember who you are. They might can look at you and see you and know you belong to them somehow, but they might not remember your name. Or they can look right at you and ask you where your whatever your Amanda is. If they're looking at me and say, where is Amanda? And they could be looking for that younger Amanda, the little girl Amanda. So it can be emotionally draining when you see the person you're caring for just slipping right in front of your eyes. The guilt of a caregiver about not being able to provide enough care. They don't want to leave the loved one at home. I've never had a caregiver yet to come to me and say, I asked for to care for someone with dementia, and raising their hands and jumping up and down. No, it doesn't happen like that. This diagnosis falls on the family and it comes out of the middle of nowhere. And once it's hit, it's like, what do we do next? Once they get that diagnosis out of that physician's office, they are so overwhelmed at that moment. It's like, where do we even start or begin with this disease process? So we're going home, we're caring for our loved one. Caregiver burnout can cause emotional and physical overwhelming. Again, we have a lot on our plate now. We're caring for this loved one that has dementia at home while we're still working. We're caring for our family. We have a lot going on. The physical challenges, lifting and transferring, caregivers may need to assist with lifting and transferring or providing mobility support for that loved one that has that diagnosis at home. Home modifications. What can we do to adapt our homes to create that safe environment for the loved ones that lives with us? What special equipment may be needed? Hospital beds, handrails to help them maneuver around the home that's safely. Another thing that, we just don't think about that can become a fall hazard, and that's those throw rugs that mom might have had around the house. I mean, she's lived in this house for over 30 years and it is a beautiful, lovely home. And she has throw rugs in every room. Well, mom is now not walking like she used to. She's starting to shuffle her feet a little bit. She's not picking them up quite as much. And she's starting to fall. So another thing to look at are those, what's the safety in the home? How can we help her remain safe? And, removing just something simple as a throw rug that might be in the floor that's causing her to fall and trip. Medical expenses, medications that come with the diagnosis of this disease, and other chronic illnesses that they may have, it could cause a burden on families. Financial challenges, loss of income. We have caregivers who have to move in again with their loved one. Some retire early, have to move their loved ones in with them, leaving a job. And time management, if you're still working full time, again, managing that time from work to family to caregiving, all of that in one day, just saying it is overwhelming. Okay, next slide, please. So again, who's caring for that caregiver? Caregivers have to please seek out resources. You have to seek out time for yourself. Getting the education and training piece to dementia, finding things that are online, such as today's training, in-person workshops, support from family and friends. It's important to have that circle that's going to be there to support you and back you for whatever things you may need. Attending a community support group or online. There are some support groups that are online that you can tap into to help, just communicate and talk with others, socializing, seeing where families are in their caregiving journey with this. And some can advise on, hey, this is what we tried when mom was at that stage. Or, if you're just fairly new into it, just getting in there and just listening to, the conversation centered around the diagnosis. Respite programs, such as what I support for the state of North Carolina, trying to help give those caregivers a little bit of a break, trying to help with that overwhelming and stress that comes with everyday caregiving for someone living with dementia. And then physical and mental exercises, meditate, read the Bible, put yourself in a different space mentally so that you can get a little bit of a break from caregiving and, just exercising, walking around the house. I have caregivers tell me I can't leave, in those moments when, you do have time for yourself, walk around the house. That's exercise. Walk outside in the yard and things like that. Next slide, please. So the other resources, again, my program, the Project C.A.R.E program, it is statewide. It's in all 100 counties of North Carolina. There's also the Family Caregiver Support Program that's in all 100 counties of North Carolina. These two programs are usually centered in an area agency on aging, such as the one that I sit in, which is Mideast Commission Area Agency on Aging. And then you have like your Dementia Alliance of North Carolina and the Alzheimer's Association Eastern Chapter. They are both in Raleigh, North Carolina as well. So tap into these resources, see what's out there, see what can help you support you and your loved one living at home so that they can be there for as long as possible, as safely as possible, and you as well. Not everyone wants to place their loved one in a nursing facility or assisted living. And not only that, not everyone can afford to. So, the home resources, we know they thrive much better when they are in an environment that they're used to. So, if you can get the support from the community to help you provide that inside the home for as long as possible is really what you want to do. Just tap into those resources. Next slide. Find something fun to do with the respite grant vouchers that are out there. When we assess caregivers, we tell them, just find something that you want to do, you used to do before caregiving has come in and consumed your entire life and has taken over. Go dancing, meditate, play a sport, have date night with your significant other. Go to church. I had a caregiver to tell me she hadn't been to church with her husband in about a year because he would go one Sunday and she would go the other Sunday. They had to, bounce back and forth of who would go which Sunday because mom could not be left alone. So, with the respite grant voucher, they could get someone to come into the home and be there with mom, and they can now go to church together. And not only that, go out to eat lunch after church, things that they hadn't done in a couple of years together. Take a vacation, put your mind in a different space other than caregiving. These ideas helps you to go and recharge your caregiving battery so that you can come back and be an even better caregiver for the loved one that you're caring for that has dementia. It just helps holistically the family. Next slide. All right, that's my presentation. I want to thank you guys for listening to me. And if you have any questions, next slide, Dr. Robinson, that's my contact information. You can definitely screenshot it or give me a call or shoot me an email, especially if you're a caregiver that's care for someone at home living with dementia and need respite for that. Thank you.
Thank you very much, Amanda, for that great overview. Does anyone have any questions for Amanda or for Dr. Delgado? Don't be shy.
I have a question. I For Amanda. Hi, Amanda. I'm Ellen Roberts with C.A.R.E. And does Project CARE, do you cover the whole state?
So my territory is 29 counties, which is the entire northeastern region of North Carolina. But the program is in all 100 counties of North Carolina. If you look on the website that I had in my presentation, there's a state brochure, and it breaks it down by counties.
Okay, thank you.
You're
That's
welcome.
great.
Absolutely.
Yeah, that's great.
Mm-hmm. Thank you.
This is Loretta Farrington from UNC. This is the first time I've joined one of these calls, so thank you for this. I typically pull data for researchers from the EHR system, but I'm particularly interested in this because my mom has dementia. I'm just wondering, because we talk about the growing numbers of elderly folks. I see the cost of nursing homes and care as being a huge, huge barrier. Do we have any sense of what the future looks like in that regard?
Dr. Delgado?
That depends on there are a lot of things going on right now related to CMS and the federal government and funding, and that will depend demand and supply, right? So that will depend on what federal resources continue to be available. And so for example, and I pulled these numbers the other day, I'm always just digging into things. And so on average, you're saying, I looked at a particular nursing home because I was just curious. And this particular nursing home was charging, if you were Medicaid and you were not rehab of any sort, just long-term stay, it was about $320 a day. Right. Versus if you were Medicaid and therefore rehab, they were getting reimbursed about 500 and, 500, more than 500 a day. But then you look at the cost of staffing, and if the proposed 24/7 RN staffing rule goes into place, then the nursing homes are going to want more money, because they're going to have to pay those nurses. So there's a lot in the air right now. I think that one of the things that I've seen over the years that is a huge factor, if you look, like I can go and look at medical supplies, and I say that I work for an organization or even magazines. I did not know this until a few years ago. If I order a particular magazine subscription, and I say that I am a medical organization of some sort or healthcare organization, period, they will charge me 5, 6, 7 times the amount for that subscription.
Wow.
Versus I say I'm an individual. So until we address those issues, the cost is going to continue to rise. So, I mean, this is not, I mentioned it earlier, there's no one discipline or one person that's going to be able to fix this. It has to be multifaceted. And but it has to be done.
I agree. I think, yeah. Thank you.
I think another thing is that we really have to be very proactive right now. I talked with somebody yesterday who was in meetings about yesterday in North Carolina about what were they going to do with the amount of money that they were going to be asked to potentially return to the federal government. And they were talking about Medicaid cuts and also CAP. And I know Amanda talked about everybody wants to keep their loved one at home. But if we lose those CAP dollars, if we lose Medicaid dollars, potentially people are going to end up in long-term care earlier than they would have before, which is going to cost probably 4 or 5, I'm not sure, I know there's statistics on it, more money than if they were able to be maintained at home, which, Project CARE and those programs are aimed towards keeping people at home. But we really need to be very proactive right now in letting our federal and our state people know that we're opposed to cuts in Medicaid and CAP programs and those kind of services.
Absolutely.
I think I have a question. So I joined this call because my niece is actually taking care of my mother. She started taking care of her in October, and she is a lay caregiver. And so my question, I guess, goes to Dr. Delgado. I'd like to have my niece participate in your training that you have coming up this summer. So I'm wondering how I can make that happen because she probably needs some training. Well, I know she needs training. I would need training because I'm not a nurse, so I would need training myself as well.
Listen, nurse or not, if you're not used to dealing with persons living with dementia, you need training. I've had years of training, so I still need more training. I learn something new every time. And so once approved, then the information will definitely go out to our community resources. So if you did not get Project CARE information, get it now and get on their, email newsletters. And so I've had like the Council on Aging that keeps asking me, like, when are we doing this? When are we doing this? Because our caregivers want it. So those are the ways. Also, if you are not a part of LinkedIn, I would recommend that because I don't intentionally post a lot, but our dean at ECU loves to post all the things we're doing on LinkedIn. So I'm sure that will be one of the resources, but the information would definitely be shared with our community caregivers and also through social media.
Okay. And Amanda, I screenshot your information.
Awesome. Thank you.
And Jackie put in the chat contact information for Amanda and Dr. Delgado, if you want to put your email in there, that may be helpful as well. Do we have any other questions for our speakers? I would like to know when the two of you are going to help the nursing textbooks and write a chapter on long-term care and caregiver support.
Yesterday.
To be continued.
Amanda, I would ask, what do you think is, because there's all walks of life on these sessions, and from a healthcare provider standpoint, I'm a family nurse practitioner. What do you think is the most important question that I need to ask when a caregiver brings their person to see me for healthcare? And it does get to the point where really it's not about that patient anymore. It's more about the caregiver. What's the most important question I should be asking my caregivers when they're there?
So, and at that time, they may not even know, especially if it's a brand new diagnosis, they might not even know what they need in the moment. It's when they get that diagnosis. I would love to see our physicians, when they give a diagnosis, to hand over some type of resource manual or information or something to our caregivers and say, hey, I know this is a lot right now. It's a bit overwhelming with the diagnosis, but take this home, look through it and tap into these resources. Just start calling and emailing people to see what's out there to help you with your loved one on your caregiving journey that's about to start, because it's going to be a journey. It is a marathon. It is not a quick race.
And it would be really great if those resources are specific to that community that you are working in.
Absolutely. Mm-hmm.
And also just emphasizing, because I had, actually it was 2 health science students that were asking me questions because they said they helped care for their grandmother. And so I was telling them about the different options and different trainings. And I was like, positive physical approach, talking about how to help, that person with eating and all these things. And they were like, well, no, she doesn't need help right now with that. And I said, well, why would you wait until she needs it?
Mm-hmm.
And they were like, we didn't think about that. You
Right.
want to be prepared when the time comes. So
Yeah.
being proactive, definitely.
Mm-hmm. Mm-hmm.
Oh my goodness. I'm having Old Home Week in the chat. One of my former students is on. Yay, I remember you. I'm so proud of you. It takes a village, really. And do we have any other questions for our speakers? And this has been recorded, so it's can be shared. I know there was a lot of people that were not able to attend, but they wanted the information. Well, thank you so much, Amanda Biggs and Kimberly Delgado. We appreciate you sharing your expertise and your information and your willingness to have people reach out to you.